So we know that running into this global pandemic, 1 in 5 Victorians every year would seek support for a mental illness. We know that over the course of our life, 1 in 2 of us in the entire Victorian community seek support for a treatable mental illness. And we know that the global pandemic since March has seen a substantial increase in demand for all of the services that state, Commonwealth and community organisations provide in this area. We've invested over $130 million in new programs over that period in time, and most importantly, we, together with New South Wales, were part of the National Cabinet's endorsed proposal for a national pandemic mental health plan, which is in the process of being rolled out. And just in the last few days, we've seen the Commonwealth provide $12 million in extra support for those frontline services, Beyond Blue, Suicide Helpline, Lifeline and others. And then on Friday, the Deputy Premier announced a $26 million package for support for young people in dealing with mental illness, the demands at schools and the fantastically successful support in school communities and the Navigator program to deliver that intensive support to young people where they need it. And today we add a further $59.7 million to focus particularly on that acute end of the mental illness spectrum in response to the increasing demand that our acute services have seen, whether they be in a clinical setting in a hospital or in a community setting. We know that particularly at the moment, we want to keep those people with mental illness away from particularly emergency departments. Emergency departments are busy at the best of times, particularly now in the height of the pandemic. We want to make sure that we keep those people who need support for mental illness with the support they need in the community. And that's the main focus of today's package, is how to deal with the surge in demand. And I'll just share with you some of the figures that we've seen in the increase year on year. These are figures to the end of July. We've seen a 9.5% increase year on year for presentations for self-harm in our emergency departments across all age groups. For young people under 18, we've seen a 33% increase in presentations for people with self-harm in emergency departments. And overall, across all aspects of how mental illness is presented at our emergency departments, we've seen a 23.3% increase in people presenting in those acute settings with a mental illness. So the object of this package is to make sure that we shift that focus immediately and sustain it over time into more community settings. That is better in terms of treatment for those people, and more importantly, it frees up the resources in our emergency departments as well. And that will take a variety of forms. It will take extending to 7 days a week the area mental health services, community mental health programs, which are currently Monday to Friday, as well as extending the hours. That will be psychiatric support, that will be allied health professional support, that will be data, that will be record keeping, everything that's needed to make sure that those services are closer to where people need them, where they live, and the support they bring. But we also know from the work that is being done out there in the community that we need to more assertively engage with some people in the community. So programs with the Headspace organisations, with non-government partners right across Victoria to make sure that we can identify those most acutely unwell, particularly young people, and take the wraparound services to them in their community settings, where you not only get better results, but you keep people away from the distress of an emergency department where we've seen such a spike in presentations. The program will also extend support to, as the Premier has indicated, our frontline paramedics, our support workers in whether it be nurses, midwives or personal carers, to get the support that they need. More support, particularly through the Phoenix Trauma Centre for police and ambulance workers, dealing with the trauma and the stress that they're all under at the moment. And the program will also make sure that when we have 3 trained clinical professionals in the Ambulance Victoria Referral Centre, to make sure that the mental health components of what goes through the 000 line is dealt with in a way that again gets people the support, the information and the referrals they need closer to them and in their community, and keeps them out of whether it be the ambulance system or the emergency department system. There's also support for our carers. We've seen increased demands on families and carers and people with lived experience directly of mental illness. So there's support for the peak organisations in those areas to provide both material aid, material support to families, as well as further counselling and support efforts. That's a fair swag of the package that's outlined in the media release today. The other component of the release is the fact that we knew running into this global pandemic that our mental health system wasn't fit for purpose, and that's why we've are holding Australia's first Royal Commission into our mental health system to make sure that people get the support where they need it in a timely way. So the other components of today's $59.7 million package go to fast-tracking 2 major components of the Royal Commission's interim recommendations. Acute mental health beds, particularly in those communities that need them. We had previously announced, as the Royal Commission had indicated, the important work that needed to be done in the Barwon region, the western suburbs, the Melbourne Health catchment and the Northern Hospital catchment as the areas most in demand. We're today announcing the specific locations of the 144 beds that will be rolled out in those communities, and I want to particularly focus on the innovation attached to the hospital in the home programs, acute support delivered by Origin Youth Mental Health Services, the most world-leading program of supporting young people in the northern and western suburbs with acute support in their home, and making sure that that innovation delivers the really world-leading support to get young people and families back on track as soon as possible. The other component that the Royal Commission's interim recommendations spoke of was the HOPE program, the post-hospital suicide prevention program. The Commission had set a timetable to roll that program out around all 23 mental health regions across the state, and today we bring forward the last 7 to accelerate that timetable to make sure that we respond again to those needs. We know that the greatest indicator to prevent someone suicide is to deal with that person in their community when they've expressed suicide ideation or attempted suicide in the past. And the best way to do that is to use our links in our community sector, in our hospitals, and in those communities wrap services around people to make sure that we give them a pathway to recovery. The HOPE program, this whole mental health package, of which this is the 3rd component in the past week, is about telling people we value you, your existence, your role in the community, your life is important. The pandemic is stressful. The pandemic is seeing anxiety and depression levels rise quite substantially, but there is help out there. There is support out there, and all levels of government are cooperating at an unprecedented level with record levels of support to make sure that that message of hope, of resilience and recovery is at the forefront of what we do. So if you need support, call Beyond Blue, call Lifeline, call any number of the specialist service organisations out there and get the support you need because it is available.